What is a stroke? A stroke occurs when the blood supply to a region of the brain is cut off or is reduced, resulting in a loss of oxygen and nutrient flow to the brain tissue. The brain cells will begin to perish within minutes of a stroke. Evidently, a stroke is a medical emergency, and early action can reduce brain damage and other complications. With the advances in modern medicine, strokes can now be treated and prevented, and they can have a significantly lower fatality rate than in the past. There are set characteristic symptoms of a stroke, and their duration is crucial as it affects treatment options. The person may have trouble speaking or comprehending topics, commonly slurring words and experiencing confusion and difficulty understanding speech. Another hallmark symptom of a stroke is immobility or numbness of the face, arms, or legs, commonly only on one side of the body. One side of the body may become partially paralyzed, and the mouth may droop. Other symptoms include trouble with vision, headaches, and trouble with motor functions, such as walking. The common acronym used to denote stroke symptoms is FAST, where F is for face. The face may be drooping or sluggish. A is for arms. Get the person to raise both arms. If one arm is unable to rise up, or if one arm drifts down, the person could be having a stroke. S is for speech. The person's speech may be slurred or impaired, and T is for time. During a stroke, blood flow is being cut off from the brain and the brain cells are dying, so it is crucial to call 911 immediately to get medical help. The longer a stroke goes untreated, the more brain damage can result. The different types of strokes. A stroke can be caused by a blocked artery, known as an ischemic stroke, or by the leaking or bursting of an artery, called a hemorrhagic stroke. There can also be a temporary blockage of blood flow, known as a transient ischemic attack, or TIA, which doesn't fully result in permanent damage. Ischemic strokes are the major type of stroke, consisting of roughly 80% of cases. Ischemic strokes are where the arteries leading to the brain become narrowed or occluded, resulting in reduced blood flow, known as ischemia. There are multiple types of ischemic strokes, but the two most common types are thrombotic and embolic. Thrombotic strokes occur when a blood clot or a thrombus forms in an artery that supplies the brain with blood. These clots can be fatty deposits that form over time, or they can come from other artery conditions. An embolic stroke is where a blood clot forms somewhere else in the body, known as an embolus, usually in the heart, and it then moves through the circulatory system until it reaches the arteries of the brain. A hemorrhagic stroke is where a blood vessel in the brain is either leaking or it ruptures. These hemorrhages can result from many conditions, including high blood pressure, excessive treatment with blood thinners, and cerebral aneurysms. If you would like to learn more about aneurysms, I will link one of my videos on it in the description down below. Hemorrhagic strokes can also be caused by a rupturing of a malformed web of thin-walled blood vessels, known as an arteriovenous malformation. Examples of these strokes include intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhages are where a blood vessel in the brain ruptures and the blood floods the surrounding brain tissue, damaging these cells. The brain cells that are upstream of the leak are also deprived of blood flow and are also damaged or killed. Causes of this type of stroke include high blood pressure, vascular malformations, and the use of blood thinners. Subarachnoid hemorrhages are caused by the bursting of an artery or blood vessel near the surface of the brain, causing blood to fill the space between the brain and the skull, along with flooding the surface of the brain. The major indicator that this type of stroke has occurred is a sudden severe headache. The area that commonly ruptures in a subarachnoid hemorrhage are small sac-shaped aneurysms. The blood vessels in the brain will widen and narrow spontaneously in a process called vasospasm after the hemorrhage, and this is an effort to reduce the amount of blood loss. Unfortunately, this effect also causes brain cell damage by further reducing blood flow. A transient ischemic attack, or a TIA, is a mini-stroke. It's a partial or temporary blockage of an artery in the brain, and it causes temporary stroke symptoms. In a TIA, there's no prolonged symptoms and usually no brain damage as a result of the blockage. It is imperative to seek medical attention even if the symptoms disappear, because having a TIA greatly increases your chances of getting a clot that completely blocks the artery. It's almost impossible to determine what type of stroke you are having based on the symptoms alone, so it is crucial to seek medical attention because even if the symptoms last only a few minutes, permanent brain damage can still result. Many risk factors influence your chance of having a stroke, including lifestyle factors, medical factors, and others. The lifestyle factors include physical inactivity, heavy drinking, being overweight, and the use of certain drugs, such as cocaine and methamphetamines. Medical risk factors include high blood pressure, high cholesterol, cardiovascular disease, smoking, diabetes, and family history of strokes. Other factors include age, sex, race, and hormones. Being above the age of 55 increases your chance of having a stroke. Men are at a higher risk of having a stroke, but women usually have a stroke later on in their life, and strokes in women are commonly more fatal. African Americans have an increased chance of having a stroke than people of other races. Certain hormones, such as the use of hormone therapies or birth control pills, cause hormone imbalances in the body, and these imbalances have shown to increase the risk of having a stroke in the patient. Strokes can cause temporary or permanent disabilities, and this depends on how long the blood flow was cut off to the brain and which parts of the brain were affected. Some common complications include paralysis or loss of muscle movement. Paralysis on one side of the body is common. Physical therapy may help the person retain some motor functions on the side affected. Difficulties talking or swallowing. A stroke can affect the muscles in your mouth and throat, making it difficult to swallow, known as dysphagia, eat or talk, known as dysphagia. Your ability to speak or understand words may also be hindered, and language therapy may be useful in these cases. Memory loss or thinking difficulties due to brain damage. Emotional problems. Stroke patients may have problems controlling their emotions. Pain. Stroke survivors commonly report pain, numbness, or tingling sensations in the body parts affected by the stroke. Stroke survivors also commonly develop central stroke syndrome, where they become sensitive to temperature changes. Changes in behavior and self-care ability. Stroke survivors are commonly more reserved and less active in social settings, and they may need help with their daily chores. Stroke prevention strategies are similar to those that prevent heart disease, such as controlling high blood pressure by exercising. Reducing stress and maintaining a healthy weight and diet are big influencers in reducing your chances of having a stroke. Having a diet high in cholesterol and saturated fats increases the chance of plaque formation, which can then break off and become clots, so reducing these are important. If this is not manageable through a diet alone, your doctor can prescribe medications. Quitting tobacco use. Being overweight contributes to high cholesterol, heart disease, and diabetes, all of which increase your chances of having a stroke. Even losing a small amount of weight, such as 10 or 20 pounds, can significantly reduce your chances of having a stroke. Eating a healthy diet, rich with fruits and vegetables. The Mediterranean diet, which focuses on eating fruits, nuts, vegetables, whole grains, and olive oil, is a good diet to start with. Regular exercise. Exercise lowers blood pressure and improves the health of your blood vessels and helps you lose weight, all of which are important factors in strokes. Alcohol consumption. Alcohol can cause and protect you from having a stroke. Heavy consumption increases your chances of getting high blood pressure and having a stroke. However, drinking in moderation, such as 1 drink a day, can reduce the blood's clotting ability, therefore reducing your chances of having a stroke. But moderation is key. Illicit drugs. Some street drugs dramatically increase your chances of having a stroke, such as cocaine and methamphetamines. If you yourself had a stroke or have a family history of strokes, your doctor may place you on treatments such as antiplatelet drugs or anticoagulants. Platelets are the cells that stick together and form clots, and antiplatelet drugs inhibit the platelet cells from aggregating together, the most common treatment being aspirin. Anticoagulants reduce blood clotting, and the most common products administered are heparin and warfarin.